Welcome once again to SoCo Chat, a podcast where we hear directly from county leaders, discuss the latest news, and talk about all things concerning our beautiful corner of California known as Sonoma County.
Welcome back to SoCo Chat. I'm your host, Matt Brown, Deputy Communications Manager for the County of Sonoma. Thank you for joining us. Our topic today is HIV and AIDS, and what the Sonoma County Public Health Division is doing to raise awareness about this communicable disease. We've covered similar ground this past fall, but this is an important topic, so we're revisiting it again today. As our guest today, we welcome back Miranda Patrick, a public health nurse who specializes in sexually transmitted infections and who's particularly focused on HIV. But before we get to our interview, I want to start with our trivia question. Our question today is, which U.S. state has the highest rate of HIV diagnoses? I'll give you a hint. It's not California. California is 10th. If you know the answer, call us at 707-565-2242 or email us at publicaffairs@sonoma-county.org. If you're correct, you'll be entered into our weekly drawing for a chance to win a SoCo Chat coffee mug. With that, let's get on to our discussion. Welcome back, Miranda.
Thanks
for being here.
Thanks for having me.
Of course. Well, this is an important topic, as we said, and there's a lot more to cover that we didn't cover in the first time. So just let's start with a little bit of a reminder. What's the difference between HIV and AIDS?
Yeah. HIV is the human immunodeficiency virus, and usually most people get it by having sex without a condom or sharing injection drug equipment. Can also be spread from a mother to a baby, but not with the medications we have today. And that's the virus that infects a person, and that attacks your immune cells, so the cells that help make up your immune system. And then AIDS is when you've had HIV for a number of years, usually about 5 to 10, and the virus has broken down your immune system to almost nothing, and you can get sick with most things that wouldn't even cause harm to a person living with a normal immune system.
So
that's AIDS. That's acquired immunodeficiency syndrome.
Gotcha. Good. Well, tell us what's been happening recently and what's been going on with public health in regards to HIV and AIDS.
Yeah. So with the advancements that that the world of AIDS has made, there is a lot of hope in even when getting diagnosed with HIV today. People can just take one pill once a day or even an injection every other month and keep this undetectable viral load, meaning that they won't be able to even transmit it to their sex partner, even without a condom, it keeps their virus at bay, and it doesn't affect them anymore either. So people can live a long, healthy life with HIV. But post-pandemic here in Sonoma County, we've been seeing spikes in HIV. In 2022, we hit 42 cases of people newly diagnosed with HIV, that is, in 1 year. And we hadn't seen a number like that since 2011. So bringing us back quite a bit. And then unfortunately, since the start of this campaign in September, we don't know if it's correlated. In the last 12 months, we've had a high of 48 cases, a number we haven't seen in about 20 years. It's extremely concerning, but we are hoping that it has to do with our campaign. And if people started testing, then that means that the number of positive people per 100 tests or something could be remaining the same while we're just testing more people. But we don't know if that's what's happening or if the positivity rate, if more people are actually infected, and that's why our numbers are going up. We're hoping it's the former, not the latter.
So it is going up, the rate's going up, but these are people being tested and now they know their status, right? So it's better to, if you're going to live with it, know that you have it rather than not, right?
Yeah, that's the only way to, contain the spread of it. So yes, knowing your status is critical.
Absolutely. So tell us again, who's considered high risk for getting this?
So, right now, there's still definitely those high risk categories. Men who have sex with men, gay, bisexual, or otherwise identifying. or if those people are in your, sexual network. And also people who use injection drugs. But really, right now, I am recommending everybody get tested, because with our numbers and the people that are becoming or who are testing positive, there really seems to be no rhyme or reason. You can't base it off of gender or sex or sexual orientation or even, socioeconomic background. It seems like we're getting someone from every single group. There still are high numbers with our gay and bisexual men, though heterosexual people, it is on the rise as far as our numbers are concerned, as well as people who identify as Latinx or Latina.
Interesting. So let's say you are a member of a high-risk group, or just any group. As you mentioned, you should, anyone can get tested. And let's say you do get tested and you're negative. What to do then?
Yeah. So one thing to know is that most tests take at least 2 to 4 weeks to become positive. And so if you test right after you think you may have been exposed, say even the day after, your test is going to be negative unless you had previously contracted it. So, but if it's the day after, there's actually something called post-exposure prophylaxis, or PEP. And most ERs can offer you PEP. And if you truly were exposed, you can stay on a medication for a month, and that actually prevents you the transmission of HIV. It doesn't allow it to take hold in your body. And then if you feel that you may still be at risk after the course of PEP is done, or if that wasn't the right thing for you at the time, there's also PrEP, which is something someone can take by pill or injection to continuously protect you from the virus from entering your cells.
Okay, interesting. What are some of the preventative options in general to live a HIV-free life?
Condoms are still very effective, and I'd say the PrEP is our biggest thing. It's almost 100% effective, especially the injection, because you don't have to forget. There's no chance that you forget to take it, at least in the interim 2 months while it's effective. And the pills can be used a number of ways depending on how what your sex life looks like, or your risk factors if you are otherwise at risk, like through injection drug use. It can be effective that way. There's just not a lot of research with PrEP and injection drug use. And then I don't want to also forget to mention that there is also now prevention for other STIs, and that's called DoxyPEP. It only was approved for use in 2023, so you might have a hard time finding a provider that is comfortable using it, but we do have providers in Sonoma County that use DoxyPEP, and that prevents chlamydia, gonorrhea, not gonorrhea so much, and syphilis. Gonorrhea has a little bit of resistance, so.
Okay, interesting. So there are options out there for people. Yeah. What happens if you get tested, as everyone should, as you mentioned? You get the results back. It's a life-changing result. It's a positive test. You mentioned people can live long, healthy lives with that diagnosis. So tell me, what's the next step for someone who's diagnosed positive?
Yeah. Luckily, we have a lot of help here in Sonoma County. And so there are a lot of options. Even if you've already progressed to AIDS, if you get started on this pill, it's usually this one pill once a day, or the shot that's every other month. You can build your immune system right back. The medications stop the HIV in its tracks. It has very few side effects, not like it used to be decades before. And as I said before, then this medication will stop the virus from hurting you, and it also stops it from spreading to other people. There are still programs to help pay for medical visits and labs and medication. And in Sonoma County, we still have programs that help with housing and food. So we have a lot of resources in Sonoma County that can help people newly diagnosed with HIV.
That's great. Yeah, and so you can live a long, healthy life.
Yeah, even if someone is diagnosed at 20 years old, if they get on medications, they can still live well into their 70s now.
Wow, that's great. Good,
Incredible.
advances have come a long way, right? Yeah. I've heard this term opt-out testing. Can you explain what that is?
Yeah. So opt-out testing is an approach to HIV testing that a clinic, an ER, or a jail can take, or a prison, and in which that everybody who walks through the doors is tested. Sometimes it means everybody, and sometimes it means everybody in a certain group. Like an ER might choose to do everybody who gets their blood drawn will then be tested for HIV. And what this does is it takes out all the guessing, which can be very good, especially in a situation like we are in Sonoma County right now, where you really couldn't pinpoint who might be at risk for HIV. It also destigmatizes HIV and testing for HIV, because everyone's getting tested and you're not being called out for, like, you're at risk for HIV, so we better test you, which can be shaming and very stigmatizing. Because part of this campaign is actually just trying to destigmatize HIV so that people will get tested, because there is so much shame and stigma associated with HIV right now still, that people are afraid to test because they don't know what's going to happen. And, back in the 80s, people wouldn't even talk or be in the same room as you. And obviously we've come far from that, but I think the memory of that lives on.
Interesting. Yeah. I know you've been doing radio shows. There's the Public Health Division has a campaign going to raise awareness. Why is this outreach so important to do around HIV/AIDS?
Well, because, it's not in the forefront of people's minds anymore. And because the demographics of who is being affected is changing, people don't know who should or shouldn't be getting tested. The CDC says that you should only get tested once in your lifetime. And it doesn't account for the fact that, people have ongoing risk factors, so that if they tested 10 years ago, their lives have changed since then. And right now, I'm suggesting that people test every time you have a new sex partner. If you change sex partners often, then testing like every 3 months or so. And it's best to test at the same time as your sex partner, so you guys both know going in what you're going into.
Yeah, absolutely. Sonoma County's HIV numbers are relatively small, although you mentioned we are seeing a spike, and it's the highest in 20 years, but still relatively small, I guess. Why do you think that is?
Well, it's small in comparison to bigger counties like San Francisco or Alameda County. They definitely have a higher burden of HIV. And definitely if you compare it to something like the amount of chlamydia we have in Sonoma County every year, about 2,000 cases. But yes, it's relatively small. And one thing that I can say is that the people who are living with HIV in Sonoma County, about 1,500 people, are doing an amazing job, as well as their providers, of keeping people in care. And what that does is keeping the amount of virus across Sonoma County is relatively low. We call it a viral suppression rate, because as people are on their meds, then they are a lot less likely to pass HIV. If they're undetectable, it literally is impossible. But we have in Sonoma County, as of the 2023 numbers, 83.7%, I believe, viral suppression. So 83% of our 1,500 people living with HIV in Sonoma County are virally suppressed. They cannot pass HIV. And that's much higher than the state average of 66.5%. So we are doing really good in Sonoma County as far as our viral suppression rates, which obviously means that less people are passing HIV.
Well, that's a great success story. Clearly great for the Public Health Division and all the work you're doing. Before I forget, I want to mention that let the listeners know the Public Health Division does have a webpage of HIV/AIDS resources on the county website, sonomacounty.ca.gov, and then you can navigate to the Health Services Public Health Disease Control and look for the HIV/AIDS tab and find more resources there, right?
That's correct. Yeah. I've linked so that I am not constantly having to update. So I'm trying to link to the most updated pieces of information, as well as like free testing sites in the area, or there's even at-home testing, or places to get PrEP, or if you were to test positive, places to connect to care.
Great. Is there anything else you wanted to mention about what you're doing?
We're still trying to have a strong presence in our in our homeless encampments and other rehabilitation centers and things like that, trying to bring testing to the people that may have other priorities on a day-to-day basis, like finding shelter and food. So trying to still help the people out there that don't have exactly the best access.
Yeah. Well, it's important work on an important topic, and we really thank you for all the work that you're doing.
Thanks for having me.
Yeah, and thanks for being here to talk to us about this. It's a very good topic, and we'd love to have you back sometime. And for being our guest, we'd like to offer you a SoCo Chat coffee mug, but you probably already have one. You can have a bottle or a hat or anything else you'd like. And for our listeners, we'd also like to give you a chance to win a mug or a bottle or anything else SoCo Chat related. Just answer our trivia question for today, and you'll be entered into our weekly drawing. As a reminder, our question today is, which U.S. state has the highest rate of HIV diagnoses? If you know the answer, call us at 707-565-2242 or email us at publicaffairs@sonoma-county.org. Submit your answer to us as soon as possible, and you'll have a chance to win one of our prizes. Also, if you have comments about this or any other segment or have a suggestion for a future topic for SoCo Chat discussion, please email us at the same address, publicaffairs@sonoma-county.org. Thank you all, and we hope you continue to follow SoCo Chat on Spotify, Apple Music, Amazon, and of course, YouTube. See you next time, and thanks again, Miranda.